Hi, Rebecca Kellen. Today I'm going to talk about acute sinus infection. Acute sinus infection is the condition when the sinuses get inflamed and swollen from trapped mucus lasting less than 4 weeks, usually resolves within 2 to weeks. This video will focus on the acute sinusitis. So where are the sinus? Let's look at the image. So the nose, here's the eyes. So above the eyes, we have frontal sinus. In between the eyes, along the nose, we have ethmoid sinus. And below the eyes, we have maxillary sinus. The causes and the risk factors. The mucus trapped in the sinus help develop the sinus infection. The main causes are virus, like common colds, bacteria, and allergens. Fungus are rare. Risk factors like environmental irritants like smoking, pollution, deviated septum, polyps, foreign body in the nasal sinus, and medical conditions like asthma, immune-compromised patient. The common symptoms are sinus congestion that makes it hard to breathe, nasal discharge that could be varied from the colors, facial pressure, tenderness, and swelling of affected sinus, decrease the sense of smell. If caused by allergies, also could have watery eyes, sneezing, and a clear nasal drainage. Usually has no fever or chills, not contagious. If caused by a virus from common cold, usually also have sore throat, post-nasal drips, ear pain, and a cough. May have low-grade fever or body aches. It can pass from people to people. If caused by bacteria, besides the nasal congestion, facial sinus pressure pain, people also could have fever, chills, yellow nasal discharge, ear infection. The bacterial sinusitis usually happens after a common cold, allergies, rhinitis. Treatment. First, we treated the symptoms like Tylenol and ibuprofen for the pain, decongestant like Afrin, nasal spray for 3 to 5 days for nasal congestion, or oral decongestant like Sudafed, and antihistamines like Claritin, Zyrtec, and Benadryl for reducing the mucus. Sinus rinse for remove the mucus. Also treating the possible causes. If caused by allergies, use Claritin, Zyrtec, or Benadryl, Flonase nasal spray. If caused by virus, usually use the common cold drugs over the counter like Delsym, Mucinex, Dimetapp, then increase oral fluids, rest. Antibiotics uses for bacterial sinusitis, not recommended for virus sinusitis or allergic sinusitis. Clinically, if sinus nasal congestion and pressure continued for more than 7 to 10 days, or accompanied by one-side facial pain with yellow nasal discharge, then antibiotics with decongestant are recommended. Antibiotics choices, first line is amoxicillin, Augmentin. Then if allergic to penicillin, amoxicillin group, then we use doxycycline, Bactrim, DS, Z-Pak. Self-care and prevention. Avoid getting sick by good hand washing. Keep distancing from the sick people. Staying hydrated, good rest, and a balanced diet to boost your immune system. Avoid smoking. Manage the allergy and the colds. Use over-the-counter medication. Sinus rinse. When to seek medical service. So when severe or persistent symptoms, more than 7 to 10 days. 2, high fever with sinus facial pain or swelling and yellow discharge. 3, double sickness. Have sick first for a few days, got better for a few days, then sick again. We say symptoms worsening after initial improvement. Thanks for watching. That's all for acute sinus infection. Thank you. Bye-bye.